Hi there, guys. This is Alicia back. If you've been following along, you know that we unfortunately had a failed frozen embryo transfer, and I've thoroughly documented that in all of my other videos. So if you wanted to know more about that, feel free to check those out. When I last left everyone, it was actually like just before Christmas. We had done our beta test and found out it was a negative result, a negative pregnancy result. And I told you folks that I would get back to you when we have figured out our next steps. So today's video, I just want to talk about what our next steps are going to be. I want to talk also about our story up until this point. I haven't really gone into depth about that, and the main reason I want to share all of this is that there's people out there that might be able to relate. There might be people out there who are considering IUI and IVF and aren't really sure what to expect. If that is the case and you're watching this video to learn more, I will say that I feel that we've had more complications than you would typically expect. So I don't know. I think maybe we're a medium case, but I want to share our story as well. So we're going to talk about next steps. We're going to talk about what brought us to this point. And yeah, let's just get into that. So firstly, I'm just going to talk actually, I think, about our next steps. So I had my blood work done, and as I kind of suspected, because if you've all kind of watched my previous videos, had a lot of issues after transfer. So I did suspect I was going to have a negative result, which like obviously isn't what we were hoping for, but it was a bit helpful anticipating that ahead of time. So we got our negative result just before Christmas, and also during that time our doctor's office was actually closed for the holidays. So they actually did not reopen until January 7th, which I completely appreciate. These doctors and all of the support team are just working constantly and, kind of filling in overtime. So they need a break too. Now that said, I left a message as soon as my doctor's office opened again on January 7th. And on the message, understandably, they did say that it could take up to 3 to 4 days for response. So I waited quite a while for a response, and that's fine. But what we ended up coming to the conclusion of is we are going to be having a meeting on the 23rd of January. And that's just because I had so many complications. That was our first frozen embryo transfer, and I had a lot of questions, and I'm sure that my doctor has some concerns as well about how that all went for me. So that is the plan moving forward. And after that appointment time, I will be posting another video. I just wanted to check in here because I didn't want to leave you guys like for a month wondering what's going on. So that's that. I'll be checking in. What have we been doing since we got our negative? You know what? I so called it. We didn't know if we wanted to do a transfer so close to Christmas. And you know what? For us personally, I just thought if we get a positive, that's really great, because then the people that we're close to, we can share that with. And if we do get a negative, rather than, mundane day-to-day life, I have things to look forward to, like spending time with family. My husband had some vacation time. So that's really what we did. My husband had a little bit of time off, like actually for Christmas, and then also took a week of holidays kind of shortly after, like early January. So yeah, we've just been spending time with family. Christmas for us personally, I know for some this can like be triggering, but for us personally, like I get to go see my family and my nephews who I love. So that's been really fantastic. And then also, you can look back in my videos, but during the time that we were preparing for our FET, our frozen embryo transfer, I didn't expect. I was sick as a dog. I was down for the count, and it was 6 weeks of preparation that I felt extremely ill. And then when we got our negative, I was told to like stop all of the hormones, medications I was on. Like I didn't need to like slowly wean from them. So regardless, like I wasn't in great shape, you know. So all in all, I would say I was like down for the count for probably 2 months. And so getting back to our normal life, our normal routine, you know, for me, like being able to feel like healthy again and more balanced has been fantastic. And it's really been what I'm focusing on leading to this appointment and what our next steps are going to be. So yeah, like during my husband's holidays, we live in a renovation house. You might have noticed that if you've seen any other of our videos. So we installed all new flooring, and felt really great doing that. And I myself am, you know, spending time focusing again on my business and a little bit of, we actually love renovating houses. I get an opportunity to kind of do a lot of designing and become very inspired. So I've been doing that and getting back to healthy eating, running, all that. So things have been really good for us. And I'm going to go there because we're not the only ones. So actually my husband and I, regardless of what we discussed with our doctor on January 23rd, my husband and I have decided to do some couples counseling, and we're going to be starting that on January 31st. Because, you know, the truth of the matter is that fertility treatments, especially like the longer the history gets, it's full of ups and downs and anticipation. And when I wasn't well personally, I wasn't my best self, of course. So I feel like my ability to connect with my husband was compromised, of course. And then he's very concerned about me, and that just became the focal of our relationship. And then also, to be honest, moving forward, we have 2 more frozen embryos, and we only had 4, and like 2 are gone. So we're feeling some stress and some pressure. So we're going to go and start counseling just to make sure that we're our best selves, we're in our best place. So moving forward, that's what it's all about. Like, we're doing this because we as a team want to raise a family. So we're just getting back to our focus on that. So that's what's been happening since we got our results. So I'm just going to jump into our story, and I'm going to try and condense this as much as possible. And again, the reason I'm sharing this is because I feel like there's probably people out there who could relate. Maybe there's people out there who haven't been through so much and have had success, and I think that's fantastic. And maybe this can offer some perspective. And on the flip side of that, I feel like there's probably people out there who have been through more than us. And I'm not trying to, you know, paint this as any sort of competition. It most certainly isn't. But I just really feel like if we tell our stories, it's going to put some perspective on what we've been through and why we've been through it, and that we're not alone in that. So yeah, just going to share my story, and hopefully it's helpful. So I'll start off by saying that my husband and I have been trying to conceive for 10 years. I am currently 33. He's 35. So we started like trying ourselves in our relationship for like 7 years. And so I was 23 years old. I just graduated college. My husband had already graduated 2 college programs and had you know, a pretty good career, starting job, and family was really important to us. So we had been trying since I was 23. I feel like we were very young, so we let that go on for 7 years because I don't know, we just didn't really know. Like, when it doesn't work, what do you do? We had no idea. And we were young, so we felt like we had time and we didn't have to like really aggressively look into alternative options. So that's why that went on for so long. So we've been trying for 7 years, and actually here's the item that triggered our whole fertility treatment process. So in 2015, it was odd. I won't get so much into it. I had like zero pain, but I had a over 10 centimeter ovarian cyst, which I know like classes it as something else. Anyhow, like, it was over 10 centimeter ovarian cyst. I had no pain. I had no idea I had this thing until like just one day. It was like the perfect mixture of situations. So I was like very thin and lean, and my bladder was full, and I had to go to the bathrooms. But I was laying on my back on the floor, so like a hard surface, and I was playing with my dogs. And you could like literally see in my stomach, it was like flat, and then there's like this huge lump like just coming up out of my stomach. And the weirdest thing is, I don't know why I went pee. I didn't connect that the full bladder would be bringing something to the surface. I didn't connect that. So like, I went to the bathroom, made myself feel better, and I'm like, what was that? I'm like feeling my stomach and I can't really find it again. Anyhow, so regardless, that went on for a while, but it resurrected itself. I figured out that if my bladder was full, it was bringing something to the surface that was abnormal. Long story short, I ended up going into the hospital, and they were fantastic. They did like lots of tests. Not gonna lie, like, it was a little traumatic. Like, I was, imaging wasn't open like at the moment that I went into the hospital. So they thought actually that my bladder wouldn't empty. So I was like catheterized. And if you've ever been catheterized, you know what I'm talking about. And if you haven't been, I hope you never need to be. Anyhow, so I was like catheterized, and they still couldn't get things to drain. So they wanted to like keep me until imaging opened. So we spent the entire night in the hospital. They put me into ultrasound imaging, very first thing. And I'd also never had a transvaginal ultrasound. So I've got a catheter and a transvaginal ultrasound going on. And of course, you don't really sleep in a hospital bed. And the technician like was kind enough to I was like, what did you find? Like, and they just told me on the spot, rather than, because she's even said like, you know what, I'm not going to make you wait, because the doctor's just going to tell you the same thing, but in an hour. So she told me that I had an ovarian cyst, and that I would and it can be surgically removed, and I would likely lose my left ovary. And at that point I was just exhausted, and honestly, it was more like the thought of surgery like scared me. So yeah, got really emotional and stuff, and they still kept me. They called in a specialist, the on-call specialist gynecologist, to check things out and like figure out what his schedule was for surgery, because they wanted me in as soon as possible with the size of the cyst. And long story short, I did have that surgery. It was pretty tough, because the cyst was large enough that they couldn't do laparoscopic surgery, which I've had that too. We'll get to that. It's invasive, but it's a lot less invasive. It's kind of like laparoscopic. They just kind of go through, I don't know if this is helpful. They put like a couple of incisions so that they can kind of get tools in, and usually there is an incision that's very small here or in your belly button. But anyway, I had to be sliced literally halfway across in order for the surgeon to safely get to the cyst and remove it without rupture. So yeah, so that happened, and then we went for follow-up, which is when I found out that not only did I have that cyst, but that cyst had been growing for so long that basically tissue had just crawled. Like, so this is like my left ovary where the cyst is, and tissue just crawled like all the way on the outside and inside of my fallopian tubes, went around my uterus, and so both tubes and uterus were affected. And while he was in there, he cleaned all of that tissue out, which was, you know, good since he's in there anyway. And my cyst results came back. It was benign, so nothing I needed to worry about in the future. But now we're sitting and we're evaluating, like, do we have a fertility problem? Oh, sorry. I also want to mention that the surgeon was able to save like half of my left ovary. So if you are in a similar position, I didn't know this. So he was able to save half of my left ovary, which there's still egg reserve in there. So in terms of fertility, even like a half an ovary can really help you, when it comes to fertility. So anyhow, yeah, so I took the time to heal from that. I was laid up in bed for about 6 weeks. So we were still working with the gynecologist who was able to perform some tests for us to evaluate our fertility before we needed to visit a reproductive endocrinologist. So we moved forward, and of course we, for safety's sake, went through and did male factor testing, which was not an issue. So that was great. And for myself, the gynecologist performed what's called an HSG test. So essentially that is, it's actually an X-ray test where, where iodine dye is inserted through the cervix. And that X-ray is gonna basically allow really good imaging of uterus shape. And it's also, what you want to see is you want to see that dye come up through the uterus and then through the fallopian tubes as well. So that's going to indicate whether or not there is a fallopian blockage. So results from my HSG test showed that my uterine shape was not abnormal, regardless of the surgery. So it recovered really well from that. And also it showed that I had flow all the way through my fallopian tubes. However, because we had been trying for 7 years at that point, we were referred to a doctor. I don't know if he would be classed as a I don't know if he would be classed as a reproductive endocrinologist or not, but this clinic offered IUI, so that's intrauteral insemination. So we met and consulted with that doctor through a referral from the gynecologist who did my surgery. And we met for the consultation. And I had said that I had had the surgery, and I had said how extensive it was. And the doctor felt confident moving forward with IUI. So we did go ahead and do that. So essentially IUI is pretty non-invasive. So we did it twice. So the first time, just to ensure that I did ovulate, I was prescribed Clomid to ensure that I ovulated. And I was also closely monitored with blood work and ultrasound because we didn't want to risk multiple pregnancy. So I was monitored. They're kind of watching follicle growth and adjusting the Clomid amount that I would take as needed. And once the follicle reaches a certain measurement, that is most likely for a mature egg to be within that. I took an HCG trigger shot to release the egg. And then the insemination component is, I think, exactly 24 hours after taking that injection. So we did our first one, and Yeah, I mean, I remember that the 2 week wait was really tough, and I remember feeling like really positive that it was going to work, that we're finally at a point where we had some assistance uh, in conceiving. And at the end of yeah, it was negative. So after the negative, I remember thinking to myself, I'm like, we've like stacked the deck in our favor to such an extent. I don't understand why this didn't work. And of course, now I understand all kinds of components to why that might not have worked, but that was my feeling at the time. So the plan actually was just like not to meet with the doctor again and just do it again. And so instead, I had to request to meet with the doctor a second time and kind of ask that question, like how on earth could this have not worked? And so I met with the doctor and we talked about things, and I just really, for me, I said I just want to do something different this time because it didn't work. Where we did change my medication for my second IUI to injections of letrozole. But at this consultation, at this meeting, I like resurrected the significance of the surgery I had had, especially in regards to my fallopian tubes. And at this point, the doctor said, "Oh, that's interesting. I don't have like the detailed report of your surgery. I'm going to request that from your gynecologist." So we were still eager. And at the time I went in for the meeting, it was like literally perfect timing to start a cycle. So we decided to move forward with a cycle using the injections instead. And we went through that whole process again. And we were at home for our 2 week wait. And I got a phone call from the clinic. And they said that the doctor had only just received the detailed reports of my surgery, and that he thought I was not a candidate to continue with IUI, but they wished me luck that this would work. So anyhow, it was a negative, and I'm going to be honest, I had to really process from that. I felt trust that we were getting specialized assistance. And this is where I learned that, I don't know, I guess I assumed he had the paperwork of the detailed surgical report at the very first consultation. I verbally mentioned it. So I would have thought if he didn't have it, he would have looked for it at that point. But nobody's perfect, so that was a disappointment, and that was sort of developed a bit of a trust issue for us. So from there, this doctor referred us to a doctor in regards to IVF in Toronto,